welcome to another episode of Banos Talk. My name is Justin Collins. If you have questions about when and how are we going to get the coronavirus vaccine, where are the clinics located at, how can you sign up? If you're wondering what our local elected officials are doing about the problem and the shortage, if you want to know when we can expect to see a change, et cetera, then you need to really pay attention to this episode. I'm going to break down all the recent changes in the coronavirus regulations, in particularly Gavin Newsom's lifting of the statewide stay-at-home order and what that means specifically for us and what that actually means we can and can't do. I'm going to talk about what's going on at a county level and a city level to help local businesses during this time. I'm going to talk about what our elected officials are doing to take action. I'm going to talk about the reason for the shortage of vaccines, and everything I'm going to be talking about, I'm going to be able to show you my source in this video. I'll give you all those details and all that explanation in just a moment, right after a brief message from our sponsor. We live in some rather uncertain times, making safety and reassurance priceless. Biosecurity are your local Central Valley security experts, offering medical alert pendants and video surveillance systems for your home or business. Mention Los Banos Talk and receive a free 4K 1080p HD outdoor camera or free doorbell camera. So ask yourself, how much is your peace of mind worth? Call Biosecurity now at 209-635-1482. Biosecurity, your local Central Valley security experts. And we're back. Thanks for watching. So first, earlier today at a state press conference, Governor Gavin Newsom announced the immediate end to the statewide stay-at-home order in the following statement.
Well, good afternoon, everybody. Let me just jump right into the news of the day. Effective immediately, all the regions in the state of California, there are 5 regions that we have defined when we established our stay-at-home order last month. All regions effective immediately are no longer in the stay-at-home order and will move back into the blueprint. The blueprint many of you are familiar with, the blueprint we refer to as a blueprint for a safer economy.
Now, if you paid attention to what he said, it doesn't mean that everything goes away. It doesn't mean that we go back to life as it was before. All it essentially means is that the extra restrictions are basically gone and that we now return back to the state blueprint, which is the one that was the color-coded purple, red, etc. tier system that we're all familiar with. This puts most counties still in the purple tier, to include our county being Merced County. So that means that now we're under the regular purple tier restrictions. And so what does that mean? I did another video on that specific issue when we first went to the purple tier and explained it all for you. And so I've left you a link to that video in the description of this one, as well as a link to the blueprint itself. But essentially, in a nutshell, what it means is that restaurants can open up again for outdoor dining. It means that barbershops, hairdressers, etc. can open up outside. And it means that we're in a less restrictive situation than we were yesterday by far. For small and local businesses, this is rather significant. But is this a permanent thing? No, it's not. He made it also very clear in the press conference that he could always just declare again a statewide stay-at-home order if he felt need be. And so how is this calculated? How do we know? And what is the tier system calculated on? Today in the press conference, he also had an expert come up and testify as to how this process is done. And so I'm going to share this clip with you right now.
So when we went into the regional stay-at-home order, we did it with the eye on what our hospitals would experience based on today's conditions. You've heard me before talk about today's cases in about 2 weeks. About 12% get hospitalized. Over the next 2 weeks, about 12% end up in the ICUs. So those are projections. We want to not get to a place where that's already happened. So we put the regional stay-at-home order at a certain point to avoid what we saw down the road 4 weeks from now. Similarly, we use that same model, that same idea of projection to evaluate what's going on in today's current conditions. So as we project out 4 weeks with today's numbers, we can see the data that you see on your screen. this slide that shows where we anticipate, based on our models, where those different regions will be in 4 weeks. So we use this because we know today's cases, today's conditions sort of project out those 4 weeks. And we've always said that what we did with this regional stay-at-home order was to really focus on ICU capacity, the ability of our healthcare workforce, our hospital partners, all of our clinical partners across the state to be able to support patients in need of care if we saw a relatively high, extremely high rate of COVID transmission. So today, as we stand here, look at the models that include not just today's ICU conditions, but the case rates, the R effective, which is that transmission rate or how transmissible the virus is. We look forward to these projections from where we stand today.
And so, as you can see based on the clip, it's not completely based on today's numbers. It is, but it's also based on a theoretical projection based on the rate and data right now. It's based on data right now projected out to what we should see in 4 weeks. The idea is that this is supposed to be more proactive and essentially stop us from getting to a point where we're overwhelmed as opposed to waiting until we are so. The models, though, fluctuate and change as the rate change, as he stated in the press conference as well. The various data points and variables that they're using to make these projections are going to be shared publicly on the website. Now let's move on to vaccines. So, as most of you are familiar, at this point in time, the governor has changed the rules. And so, basically, at this point, we've kind of jumped some of the steps within our tier system that we were using in order to implement the rollout of the vaccines. And now, everyone who's age 65 and up is eligible to receive a vaccine. But in all honesty, that doesn't really mean a whole lot, because the reality is that we don't even have a fraction of the vaccines needed to actually administer a vaccine to every single person over 65. Now, there's a couple of things that make this extra challenging that I think you should be aware of, and I've seen a lot of questions that I'd like to answer for you. So, Merced County has received a very small amount of vaccines comparatively to other regions, and I don't just mean that in terms of because we're a lower, less densely populated area, we've received less. I mean, in terms of per capita per people, we have received significantly less help. I wonder if this is actually a fulfillment of Gavin Newsom's previous threat about a month ago, when in a press conference he stated that counties that were not very compliant in following the rules or did not want to enforce said rules about the stay at home order, that he would be more than happy to move resources, etc., to areas that were willing to comply with his rules. In the last month and a half or so, there's been a couple controversial social media posts made by our county sheriff, Sheriff Von Warnk, and they've kind of gotten into a little bit of a back and forth. I wonder if this is, in a sense, retaliation, and if we as a county are being basically punished for that. But enough of my opinion, let's get to the facts. Our county leaders and our local city government leaders throughout our county are very frustrated with the lack of help and resources from the states and the lack of doses given to us, so much so that they recently actually wrote a letter to Gavin Newsom, which I'm going to share with you right now. 6 of the Merced County mayors, including ours, Tom Faria, and signed a letter to the governor essentially arguing our case and pleading to receive more vaccines. On January 21st, submitted the following letter to our governor. Dear Governor Newsom, as mayors representing the 6 cities within Merced County, we have serious reservations over the state's allocation of COVID-19 vaccine to Merced County and would like to respectfully request your assistance in correcting this inequity. It has come to our attention that Merced County has the second lowest allocation of COVID-19 vaccine in California. Merced County's average allocation of 12 doses per 1,000 residents stands in stark contrast to San Diego County, 57.6 doses per 1,000 residents, and neighboring Santa Clara County, 46.7 doses per 1,000 residents. Just to provide a couple examples, The city of Pasadena alone has received over 3 times as much vaccine as the county of Merced, despite a population of 100,000 less. We understand that the vaccine is in short supply, but this discrepancy is far too great. We've been assured by the county that we have the ability to distribute and administer 10,000 doses per week. We know this to be the case because the cities have collectively worked with Merced County to help stand up vaccination locations and support structures around vaccine distribution. Throughout this pandemic, the cities and the county have worked collaboratively with community partners to better protect our residents and limit the spread of the deadly disease. We have made significant progress towards preparing our residents for vaccination to protect the community and help move California out of this unprecedented pandemic. However, without an appropriate allocation of vaccine doses, we do not have the ability to carry out what we've been tasked with and what our constituents so desperately need. Merced County residents are already at disadvantage due to a shortage of healthcare services in the Central Valley. This is one of many reasons why our residents are at high risk of COVID 19 and need to be treated equally to residents in other parts of the state. While we have not been made familiar with the formula used by the Department of Health and Human Services to distribute vaccine doses, it appears to be worsening long-standing healthcare inequities. Thousands of Merced County residents have signed up to be vaccinated once doses are made available. As their elected representatives, it is our obligation to make every effort to ensure that they are treated equitably. In order to ensure the ability to handle any additional vaccination volume in the future, the cities and county have worked together to facilitate the proper training for qualified professionals who can administer the shots. Merced County has proven that it can rapidly push out vaccines in a safe and responsible manner. Now, we need your help. We need a proper allocation of vaccine doses that will afford our residents the opportunity to protect themselves, their loved ones, and their community. This is a critical time with so many of our residents falling victim to and dying from this disease. We hope you understand our situation and are willing to assist. Sincerely, and then it was signed by the various mayors of the county. And as you can tell, it was CC'd to our state senator, our state assembly member, and to our congressional representative, Jim Costa. And as you can also see, Mayor Tom Frieda, our mayor, was one of the individuals who signed this letter. Now, on January 20th, the day prior to the letter I just read, we also have another letter that was signed by our state assembly member, our state senator, and our federal congressman, also addressed to Governor Gavin Newsom. And it reads as follows: As officials elected to represent the constituents and local governments of Merced County, we write to express our concerns regarding the healthcare inequalities that the COVID 19 pandemic has brought into clear view. As you know, Merced County has one of the lowest physician to patient ratios in the state. At the outset of the pandemic, Merced County struggled to increase COVID 19 testing capacity within the county and met barrier after barrier early on trying to acquire rapid testing capabilities and additional PPE, or personal protective equipment. It now appears that the trend of Merced County being under resourced is continuing with the state's rollout of vaccine doses. Currently, Merced County has received the second lowest vaccine dose allocation per resident in the state, having received only 12 per 1,000 residents. To make matters worse, 54% of the 2,275 doses anticipated for delivery to Merced County Department of Public Health for the week of January 18 were diverted because of the Moderna Lot 041L20A pause. The entirety of Merced County is a healthcare professional shortage area. Although the Department of Public Health has not made public the vaccine allocation formula, it is clear that basing the allocation of vaccine on existing healthcare resources will exacerbate historical inequities in a place where residents wait on long lists to find a local pediatrician for their children. The suggestion that they should be placed at the end of the list for vaccine for a similar reason is troubling. Furthermore, it has come to our attention that the California Department of Public Health is aware of a discrepancy between Merced County's vaccine registry, Healthy Futures, from which the state draws data, Our understanding is that the discrepancy between the state system and between the healthy futures is leading to an inadequate allocation for our constituency. The Merced County Department of Public Health has the capacity to distribute and administer 10,000 doses per week. We have local doctors and other healthcare professionals who have answered the call to help administer the vaccine. We desperately need the doses to do so. Thousands of Merced County residents have already signed up to receive a vaccine when it becomes available in the county. On their behalf, we respectfully request that you come to their aid and reevaluate how your administration is prioritizing distribution. All Californians deserve the same chance to receive the vaccine, providing San Diego County with 57.57 doses per 1,000 residents, Santa Clara County with 46.72 doses per 1,000 residents, and Merced County with 12 doses per 1,000 residents does not send that message. Sincerely, and it was signed by Assemblymember Adam Gray, Senator Ana Caballero, and Representative Jim Costa. So there you have it. Part of the case being laid out by our elected officials is the fact that we're receiving less of the vaccine per capita of residents. And there are places with actually a lower population than us that are receiving far more vaccines than we are. There's cities who have received more than our county entirely. And we're not just talking about like San Diego or something, we're talking like Pasadena. And so the point is there's an obvious discrepancy. Now, the first letter makes it sound like maybe the allocation is being decided on an algorithm and that this algorithm is determined by the amount of existing healthcare facilities. So, an area like ours, where we don't have enough physicians already, would exacerbate this problem, which is what they've pointed out. However, in my personal opinion, Central Valley has always kind of gotten the short end of the stick, to be honest. And I think that part of this is maybe somewhat of a political punishment. I think this does have to do with the fact that there was a lot of heat between our sheriff and the governor, and that there was a lot of anti corona, anti vaccine movement within our particular county, such as Atwater, which became a sanctuary city. And I think that we're being punished politically because even if the algorithm was to base this off of population or amount of healthcare, it wouldn't explain how areas with even less population than us are receiving more of the vaccine or have a similar healthcare structure and system to us are receiving more of the vaccine. So, in my personal opinion, I think we're being punished and that this is political. Can I prove it? No. But it was just about a month and a half ago that Governor Gavin Newsom, in response specifically to what our sheriff had said, about not wanting to enforce the curfew, said that he would be more than happy to divert resources and funding to areas and regions that are more willing and more cooperative in enforcing his regulations and rules. So the timing and the verbiage strongly suggests to me that as a county, we're being punished politically and being neglected for some of our elected officials' positions and stances on Corona. But that's just my opinion. Now that we've established the fact that our county is being severely under-resourced, underfunded, and that we're disproportionately receiving less vaccines, and that our elected officials are well aware and are trying to do something about it actively, we can get a sense of why it's taking so long for these vaccines to roll out to us. But there's some other things that people are not considering, that this is actually quite a logistical nightmare. So one of the things is that the vaccines have to be refrigerated, and a lot of people aren't aware of that. However, many private businesses, etc., have stepped up, and our county has the capacity, as mentioned before, to administer 10,000 vaccines per week. But that doesn't quite tell the whole story. What a lot of people also don't understand is that each vaccine truly requires 2 doses. An individual needs to receive 2 doses of the vaccine to be inoculated. And so in other words, the numbers you see when you see 2,000 doses coming, right? Effectively, that what that means is that 1,000 people can be vaccinated. And the reason being is this: when someone is given a dose, they have to take another dose out and allocate and hold that dose for when they come back for dose number 2. So really, you can take the number of doses coming in, cut that in half, and that's effectively the amount of people who actually can be vaccinated. Our county is doing everything it can. And recently we did a drive last week, which I'm told went rather smoothly. Many residents have complained after they've signed up for the vaccine, etc. Moments later, it was already they were already out, right? They already couldn't. Now you have an answer why. It's because disproportionately we're not receiving enough of the vaccine to even cover. It's a drop in a bucket, frankly. We barely touch on our population. Then you add in the fact that we've now opened it up to everyone over the age of 65. And what you're seeing is that far, far, far more people are eligible than the amount of doses that we have. And so while yes, you may be eligible, until there's an actual dose for you, it really doesn't matter. And so the logistical problem needs to be addressed. From what I can tell, our local leadership is actually really on top of it. The blame, if you will, if you want to lay it on some arm or some part of our government system, in my opinion, really lies squarely on the state in this particular instance. Our county has actually put a lot of things into place and is very much so prepared for distributing the vaccine very effectively. And based on what we saw last week, it seems to be running really smooth. The problem is that we just don't have enough vaccines. And that's not really our county's problem. That's not really our city's problem. But that's because of how many we get from the state. And how many we get from the state is determined supposedly by an algorithm. But this has not been made public and it's not being disclosed. And I'm starting to grow increasingly suspicious that it's really more political than anything. And if that is what's going on, that's really messed up because the county shouldn't be given vaccines or treatment based on how red or blue it is, based on how pro or anti Gavin Newsom it is. It should be a fair and equitable process, not political and not partisan. But this is the situation we're in, and that's what it seems to strongly suggest. Because even if it was truly as suggested based on the amount of healthcare density, I looked into that further and it would not explain the extreme discrepancy between Merced. What does to explain the extreme discrepancy between Merced County and some of the other regions is the fact that some of our county leadership, in particular our sheriff, has been in headlines a lot recently and openly vocal against the governor, and that the governor specifically threatened to withhold resources about a month and a half ago. That does account for the discrepancies. And I'm not just making it up, those were Gavin Newsom's words only about a month ago. In fact, I shared that article on my page. You can go look at it. It came from an ABC 30 article, and he said it at a press conference that I watched myself. Now, you can go online and you can register for the vaccine, and I encourage that you do. And needless to say, the more people who are on the list, it gives our political leaders, it gives them an argument to make for why we need more vaccines. If you recall in the letters that I just read off, it was specifically mentioned how many people were signed up for the vaccine compared to how many people were actually capable of getting the vaccine. So it gives our leaders some ammunition to make a case going, hey, there is a want for the vaccine that's not being met, as opposed to if few people were signed up, then it drives the case, well, they don't want it, so why bother allocating so many there? And that might be the stereotype that's already being made about our county due to the rhetoric that's kind of come out. Now, the county has looked at and recently passed several things in order to help small local businesses, such as waiving business license fees, such as waiving the fees for inspections and other assistance. And I'm soon going to have County Supervisor Scott Silvera on my show to talk to me more about the specifics of the business help that coming from the county. On our city side, we're also seeing some things in the works that should roll out very soon. Two of which I recall are suspension of late fees on water bills. The Economic Development Advisory Commission of the city of Los Banos is also doing something to try to help local restaurants. They've created a Facebook group in which they are trying to promote local restaurants throughout the city in order to help increase their business and help get through this time. Merced County is also doing a campaign in order to help support local small businesses during these difficult times. And then myself as a private individual and as the show, I'm allowing local small restaurants to be featured in my show for free of charge. Merced County also recently opened up 2 additional vaccine clinics, one being in Los Banos. If you haven't already, please like, follow, subscribe to Los Banos Talk. We have Facebook, Instagram, YouTube, Twitter, and of course, LosBonusTalk.com. Once again, my name is Justin Collins, and I hope you have a wonderful rest of your day.